Hello and welcome to my channel. My name is Kaylana. If this is your first time, then welcome. And if you are returning, then welcome back. I am coming to you from Puerto Vallarta. I decided to take a vacation at the recommendation of the program. Some of the students, and I've known friends in the past who said that, live your life and take a vacation before the program starts because there's not going to be time for a whole lot of any of that while you're in the program. So here I am. But anyways, if you all hear some sounds, there's also some construction going on, so I do apologize for that. Today's topic, I want to talk about the requirements of getting into CRNA school. I've gotten a few questions on my videos, and again, thank you so much for interacting with me. It lets me know that somebody's out there and they're paying attention, so it really motivates me the same way that I hope that my videos motivate you. I have gotten a few questions, and I've seen questions posted on message boards basically saying, hey, do I have a chance of getting in CRNA school? And I'm here to tell you, you probably do. I think a lot of people psych themselves out because they assume that CRNA schools are looking for perfection. And while it is very competitive to get into just because it's a numbers game, most programs on average take about 20 once a year. So just with those numbers alone, it is a very competitive field to get into, but it doesn't mean that it's impossible. So if you're curious to hear what it takes to get into CRNA school, please continue watching. So the first requirement is that you have to be a bachelor prepared registered nurse. I have seen that there are some programs that will accept a bachelor's in another field as long as it's related, like biology, chemistry, something like that. But most that I've actually looked at require a bachelor's of science in nursing. The second requirement is that you have to have at minimum 1 year of critical care experience. And I'm saying critical care as opposed to intensive care unit because there are some schools that I've heard of that will accept ED experience, but they're kind of few and far between. So it's safe to say that you have to have at minimum 1 year of intensive care unit because they want to know that you have experience managing drips, managing vents, not necessarily changing vent settings and whatnot, because at least at my hospital we weren't allowed to change vent settings, but just having an understanding of the vent and managing a patient on one is very important. And while I know that the ED does have some experience in managing drips, there's a debate about whether or not ICU and ED experience should be equivalent. And that's an argument for a different day. If you do have a question about it, I would suggest contacting the program that you're interested in specifically. But from what I've seen, while the ED does manage, drips, and sometimes they do manage the ICU level patients for a long period of time just because of, bed situations and whatnot, it still does not satisfy the requirement. The next requirement is your GPA. So technically the minimum is usually about a 3.0, but that's the minimum. The competitive GPA, according to some research that I've done, is about a 3.4. But this is where it gets a little bit tricky. You might hear that some of them want a cumulative of 3.4. Some of them will take in consideration only your last 60 hours, which means that basically for a lot of us who have a degree in something else, or at least attempted classes in something else, and maybe we didn't do so well, they're gonna look at your last 60 hours, which is typically the bachelor's nursing classes and your ASN, or maybe it's your bachelor's classes and your prerequisites. And the fourth requirement would be your certifications. And I'm not talking about your CCRN just yet. We'll get to that in a minute. But I'm talking about your BLS, ACLS, and PALS. Most of these are provided by the place that you work. The PALS, usually you can obtain right before you get into the program or during the program. In my program, I do not have my PALS right now. I've had it in the past, but because I do not work with pediatric population, I did not renew it. So my program will have us renew or get the PALS right before we start clinicals. And I did reach out to some to confirm that would be okay that I at least got it after I was accepted, because I mean, all these certifications cost money, and it wasn't something that I needed. However, there was a school that I was applying to that said that I had to have it at the time of application, even though the program wasn't going to start for a year. So be mindful of that. Now, as far as your CCRN and any other certification that you can think of that is going to leapfrog off of that, it is highly recommended. Some schools do require it, so if you have a question about that, you may want to contact the school that you are interested in specifically. But having your CCRN, even if it's not required, is not a bad idea. Remember, we're trying to make ourselves the most competitive as we can, so doing the bare minimum is not competitive. So CCRN, the Critical Care Registered Nurse Certification, is $335 at the time of this video, but if you are an AACN member, it is reduced to $230. It is 150 questions, and 25 of the questions do not count. It's, kind of like the NCLEX where they had some research questions involved. So as of this year, the CCRN has a pass rate of 79%. So the odds are definitely in your favor, but not everyone will pass on the first try. So finding the right study materials and the method is very important. So after you've achieved your CCRN, there is the CMC, which is a certification solely for cardiac care, and then there's the CSC, which is a certification for cardiac care post-operatively. There are people who have those and more certifications, but a lot of the schools just require the CCRN. Me personally, that's all I have. I only have the CCRN. If I did not get accepted after applying, then that would have been something that I would have looked into obtaining during the year, because what else am I going to do but I guess make myself more competitive if I didn't get in the first time. But it's not necessarily required. You do have to have your CCRN to get these other certifications. Another requirement is to make sure that you have all the prerequisites, specifically the chemistry classes. The schools that I applied to only required like general chemistry and 1 semester of that. Some of them required 2, but other schools, they might actually require like organic chemistry 1 and 2, biochemistry, just different ones. They also have time limits on their chemistry, some of them do. So one of the schools that I applied to only required that the general chemistry be taken in the last 10 years, but most of them wanted them in the last 3 to 5, which is one of the reasons why I am currently enrolled in a chemistry class now. Now, it's easier the second time around, but who wants to take it more than you have to? But anyways, so make sure if you do have a chemistry class that is the correct chemistry, usually it can't be any lower than general chemistry. No intros, foundations might be questionable, and just make sure that the specific program that you're going to apply to doesn't actually require a higher level chemistry. You may also be required to shadow a CRNA. So I came from the OR, so that was a lot of shadowing time. And I also built relationships with CRNAs, so it wasn't very difficult for me to go and shadow one just to satisfy that requirement for the schools. But I have heard of schools requiring a specific amount of hours shadowing a CRNA. They want logs, different things. So especially if you're starting out early in your process, you might want to try to figure out how you're going to get in contact with these CRNAs, because from what I've seen, it's not as easy as you would think, especially if you don't work in that environment. So that might be something that you want to start working on sooner than later. So that's basically the foundation of what's needed to apply to CRNA school. Don't forget, during your application, you'll need letters of recommendation. Some schools are specific in that they want it from nursing faculty, they want it from your current manager, they want one from a CRNA. So again, going back to, if you don't know any CRNAs, you might want to get to know a few CRNAs. If you enjoyed this video, please consider subscribing and hit the notification bell so that you can be notified whenever I post a video. Please like and comment. And if you have any questions, please leave them below. I will answer them as quickly as I can. I thank you all again for your support. It does truly motivate me to know that I'm at least inspiring those or encouraging those or whatever the case may be. I do have my Instagram, which is a personal Instagram, so I don't always post things related to nursing, but if you want to follow my journey, especially through school, starting in January, then you might see more on there. Currently, I'm on my vacation right now, and I've posted so many things related to that there. So if that interests you, my Instagram will be posted. Thank you so much for watching. I'll see you on the next one.